Hello guys, welcome back to my channel. I am Divya, a CPC certified medical coder. In today's video, we'll continue our musculoskeletal system series, that is part 2. I will be discussing the cubital tunnel injection, muscular injection and joint injection. Today we'll cover the three topics. Okay, so let's begin. So our topic is cubital tunnel syndrome. Cubital tunnel syndrome. So guys, what is cubital tunnel syndrome? What is this? So cubital tunnel syndrome is a compression of the ulnar nerve at the inside of the elbow, often causing the numbness in the ring finger and the little finger. It occurs in the cubital tunnel, narrow passes under the medial epicondyle. So it is an image you can see here, it is an forearm and here is an elbow region. Okay, and here is an ulna bone and the radius bone. So in the ulnar there is an ulnar nerve. Okay, so inside the elbow there is an ulnar nerve which is passing narrow passes under the medial epicondyle. So there is a compression in that ulnar nerve which causes the numbness. Okay, so here you can see that it is an elbow region. When you just the upper bony part, which is known as olecranon, and the lower bony part is that is known as medial epicondyle. Here you can say that here is an upper bony part olecranon, and the lower which is known as medial epicondyle. So between these two, that nerve is passing, and that nerve is passing that narrow passes is there, and it get compressed. So when it get compression, the ulnar nerve compression, it causing the pain, numbness in that ring and the little finger. So the ulnar nerve passes to the narrow spaces, which is called cubital tunnel. That narrow space is known as cubital tunnel. It occurs when the pressure increases on the ulnar nerve. When the pressure increases on the ulnar nerve, it will get compressed. So the common reasons are repetitive elbow bending, excessive the phone use, sleeping position in say same side, and leaning on the elbow for the long time, prolonged bed sore, you can say that, prolonged compression, and trauma or injury to the elbow, arthritis, thickened ligament. So symptoms are numbness in the ring finger and the little finger, pain in the inner elbow also, tingling will be there. So here ulnar nerve, ulnar bone. Okay, the upper bony part is known as what? That is olecranon, and that lower is known as medial. So between that space, cubital tunnel. And when there is a compression, what happen? There is a tingling in that ulnar nerve get compressed and tingling in the numbness in the little and the ring finger. So what is the treatment? So compression is there, pain will be there. In the severe cases, what the procedure will be there? So in non-severe cases, there is a non-surgical treatment. In the non-surgical treatment, there will be a exercise and some splinting will be there in the elbow region. Okay, and the surgical treatment. In the surgical treatment, what will physician do? There is a two type. That is an open cubital tunnel release and the endoscopic cubital tunnel release. So these two treatment will be done. That is an cubital tunnel release, and that cubital tunnel release may be the open or the endoscopic. So the open cubital tunnel release CPT is, we are discussing the 2 series, 20,000 series, but here is in 6 series, but we have to study that. Okay, and the open cubital tunnel release, that is 64718, that is in transposition and the neuroplasty of the nerve at the elbow. And the endoscopic cubital tunnel release, that is an toe unlisted CPT code. So what will physician do in the surgical treatment? Simply he will incise over the elbow region, medial elbow region, and then what will he will identify the nerve where the nerve compression done, and he will release that structure. Okay, he will release that structure like a fascia or ligament. If more nerve transposition done, the physician will close the incision. Okay, so in the open cubital tunnel release, physician will place the patient in the supine position in the back, and the arm position or an arm board. So elbow slightly flexed. Okay, anesthesia will be given. Incision made over the curved or the straight incision over the medial elbow, that is behind the epicondyle, medial epicondyle, as in so the lower bony part. Okay, so dissection will be done for the exposure of the ulnar nerve. When so dissection done, so the ulnar nerve get exposed, and the surgeon will see that ulnar nerve, and that releases these compressive structure, that are the Osborne ligament cut, fascia over the flexor carpi ulnar is released, and the tight band and the adhesions and the scar tissue removed. So, ulnar dot transposition sometimes done in same surgery. If nerve is unstable, nerve move anteriorly in the front of the elbow and placed in the subcutaneous or submuscular plane, and then the hemostasis done, means bleeding has been controlled, and then closure will be done and dressing applied in order to prevent the infection. And in the endoscopic, same endoscopic also, here is only what differences, they are minimally invasive surgery. Okay, where the physician uses small incision, and endoscope will be there, which is used to visualize, and then after visualization, the cut in the tight ligament, that is an Osborne's ligament, compressing the ulnar nerve at the elbow. This approaches reduce this trauma and achieves the same decompression as an open surgery. So physician simply what anesthesia give, uh, dissection has been done in the exposure of the ulnar nerve. After exposure, he will release or cut that ligament part. So in order to release that, so here is in CPT, ICD and CPT, lesion of the ulnar nerve, unspecified lesion on the ulnar nerve right upper limb, that is Z5620. Here is 6471 neuroplasty, cubital tunnel release, and if unlisted CPT is there, we have to give the comparable CPT code. So in the comment box, we have to what to write. In the live coding, we have to write that there is no specific CPT code available for the endoscopic cubital tunnel release. So appended the unlisted CPT code, and the comparable code is the 64718. So we'll see the one example. It's simple. Okay, cubital tunnel release is very simple. So we'll see one example, cubital tunnel release. So here is in cubital, like OP report of cubital tunnel release. So here, what is an preoperative diagnosis? That is an cubital tunnel syndrome. Procedure performed is open cubital tunnel release, and anesthesia is given. Indication is what? Patient presented with the numbness, tingling, and weakness in the ulnar nerve, and the conservative treatment failed. That's why patient come for the surgery. So see that procedure is performed in the procedure details or not. We have to check always. So the patient was positioned in supine with the arm abducted. Operative site was prepped and wrapped in sterile fashion, and the terminal incision was made over the medial aspect of the elbow along the course of the ulnar nerve, and the dissection was carried out in order to see the ulnar nerve, exposure of the ulnar nerve done, and the fascia overlying the cubital tunnel was inside, and ulnar nerve carefully decompressed. Any compressive structure, including the Osborne's ligament, were released, and the nerve was inspected and proximally and distally ensure full decompression. Hemostasis, bleeding control was achieved. Wound is irrigated and closed in layers and sterile dressing was applied. So here simply open cubital tunnel release, incision made na. So open tunnel cubital tunnel release. So we'll navigate this in 3M. Okay. So ICD, cubital tunnel syndrome. Cubital tunnel syndrome. Here it is. So here there is not written any where gone. There is not written any like which side of elbow is there, but we'll consider that. Let's consider it will be right. Okay. So G5621. Okay. Now cubital tunnel release. So release, by release what? Cubital tunnel come 4 number cubital tunnel. It is not an arthroscopic. It is an other specified. No. So 64718. Which side? Right side. Modifier right side. Okay. So this is an cubital tunnel open, cubital tunnel release. Okay. If it is an endoscopic, what will physician do? Endoscope has been inserted. We'll see that one. Open endoscopic cubital tunnel release. Okay. Here open tunnel endoscopic has been, so in the procedure detail, what will here in the procedure, an a small incision was made and an arthroscope is inserted to visualize. So if arthroscopic and any endoscopic is used, na, that will be the endoscopic. So release, same procedure, same release, cubital tunnel, arthroscopic. So it is an unlisted. So for unlisted, what I say, we have to give the unlisted comment. Okay, that if unlisted CPT, we do not have, we have to give the comparable CPT code. Okay, so that's an 3M navigation, 3M leading of the cubital tunnel release. Now coming to the next topic, that is joint injection. Okay, so joint injection. So what is joint injection? Simply we can say that physician will inject into the joint. So what is joint injection? Joint injection is a medical procedure where the physician will insert a needle into the joint space or to inject the medication like steroids, corticosteroids, anesthesia, etc. to remove the fluid. To inject the medication or to remove the fluid. Why? Because if the patient having the pain in the joint like osteoarthritis, gout, like uric acid crystal, rheumatoid arthritis, for the simply pain purpose, the physician will inject a joint to in order to either they will insert a medication or removes the fluid. Okay. So physician will insert the needle into the joint space. Okay, for two purpose, either to remove the fluid for the diagnostic or to inject medication uh, for the therapeutic purpose. So what is diagnostic? To check the condition, to check the infection, okay, to check the disease, which type of disease is there. Okay, and for the injection medication, therapeutic means in order to treat that problem, in order to treat the improve the movements. Okay. Now, so anatomical area, we have to know that there are three joints: major joint, intermediate joint, and the small joint. We have to learn that. That major joint will be knee joint, hip joint, and shoulder joint. Intermediate will comes elbow, wrist, ankle, acromioclavicular, temporomandibular, olecranon bursa, and small joint, that is finger, toes. Fingers will be metacarpophalanges, carpometacarpal carpometa phalanges. Okay, toes, tarsometatarsals, and metatarsal phalangeal joint. Okay, so there are the two classification of the joint, that is a structural, functional. In the structural, fibrous joint, cartilaginous joint, and the synovial joint. Functional, that is an pivot, hinge, saddle, plane, ball and socket, and condyloid. In the structural joint, fibrous joint means fixed, that is immovable joint. For example, skull, upper jaw, rib cage, backbone, pelvic bone. Cartilaginous, that is partially movable, comprising of symphysis joint. Example, rib cage, spinal column. Synovial joint, most common, that is fully movable. For example, knee, wrist, neck, shoulder. Coming to functional joint. Functional joint, where the pivot joint, one bone is tapped into the another bone in such a way that the full rotation is not possible. For example, neck. Okay. For the neck, we can't move a full rotation, we can't do by a neck. Okay. And hinge joint, just like a door hinge, where the only back and forth movement. For example, elbow and knee, ankle. Saddle joint, it is a biaxial joint, movement only in two plane. For example, thumb. Plane joint, that is gliding joint, the lower leg of the ankle joint and the forearm of the wrist joint. Okay, so wrist joint and the lower leg of the ankle joint, plane joint, gliding joint. Ball and socket, that is an shoulder, rotatory movement. Condyloid joint, example, base of the index finger, carpal of the wrist, elbow and wrist joint. So simply we only see the normal anatomical reason. Okay, coming to the CPT, that is an what physician will do in that joint injection. Physician will clean the area where the injection has been given by sterile technique. Anesthesia will given. Needle will be inserted into the joint space. Fluid aspirated or medication injected, or needle remove or dressing applied, and sometimes imaging guidance also done. So here is an ICD for the pain in the right knee, M25 series, osteoarthritis, that is an M17 series, we can see that. And mm, coming to CPT code. So these are the CPT code. Based on the guidance, there is for the finger and toes. So finger and toes are the small joint. So for the small joint, 2 CPT code, 20600, 20604. Okay. And what is the difference between this? Amazing guidance. Okay. There is an 20600 without amazing guidance, with the ultrasound guidance. Okay. Coming to next, that is intermediate joint, wrist, elbow, ankle. So two CPT code, 20605, 20606, with guidance and without guidance. Large joint, that is major, shoulder, hip, knee, 20610, 20611, with the guidance, without guidance, with the ultrasound guidance. So here physician maybe aspirate the fluid, or sometimes injection will be given like steroids or corticosteroid, or anesthesia will be given. So we'll see one example of the uh, joint injection. Okay, joint injection of the report. So here what physician do, there is an osteoarthritis of the right knee. Therapeutic injection has been done. Okay, so physician placed in supine position, right knee was scraped and wrapped. Identify anatomical area. Needle was inserted into the right knee joint space. Synovial fluid aspirated. So aspiration has been done. Okay, fluid removal. Uh, that is an corticosteroid, and the aspiration is done, and the injection has been given. So the needle was withdrawn, and procedure was with no complication. So here is an right knee osteoarthritis, and fluid aspiration was not required. Okay, here not required, but injection has been given. So we'll see the osteoarthritis. Osteoarthritis, right knee. Okay, primary knee will be taken, other right knee, do not wish to code. So here's what is provided. Um, Injection will be given. So will be given M1711. M1711. Now injection has been given, so we'll take the procedure. Injection, injection on the joint. Joint injection is there, no? So which joint is there? Knee. So knee is a major joint. Other. Is it with the ultrasound or without ultrasound? Ultrasound or without ultrasound? You can see here. Any ultrasound is used or not? No ultrasound has been used. Without ultrasound. Do not wish to code. No specific. 20610. So it is an arthrocentesis, aspiration or injection of the major joint, and ICD will be M1711. If it is on right or left, we'll give modifier. For example, RT modifier, right side of the body. Okay. So it is a joint injection. Coming to next topic, we'll see the muscle injection. Okay. Major joint has been done. Muscle injection. So muscle injection, we can say that trigger point. Don't confuse with the trigger finger. Trigger finger is something different and trigger point is something different. So trigger point is a procedure, or a muscle injection is a procedure where the physician will inject a medicine directly into the painful muscle knot. Here are the muscles trigger points. In human body, there are approx 600 to 650 major muscle will be there in the human body. So where will be the muscle knot will be there, or trigger point, or where the painful muscle will be there, physician will inject the medicine directly to that knot. And these knots are very tight band in the muscle that causes the local pain. So and it is performed for the relieving the pain, treat the muscle spasm or the fibromyalgia, and the common area will be the neck, back, shoulder. Okay, so here's the muscle trigger point is given. These are the muscles, and here's showing only points where the muscle knot will be there. So physician, what will physician do? He will identify the knot, that is a trigger point area, cleans that area skin with antiseptic, inserts the needle with a medication, and may inject the multiple muscles, and removes the needle and applies the dressing. Okay, ICD M79, M69. These are the general muscles and trigger points you can see here. So these are the CPT. Injection of the one or two muscle, injection of three or more muscle, 20553. In muscle injection, what we have to learn the guideline, we have to check the number of muscles, not the number of injection. Why? Because injection here is given S, multiple injection will be involved, but the one muscle will be there. So here the difference is muscle, one or two muscle or three or more muscle. So we see the example of the muscle injection. Okay, muscle injection procedure. So here's an trigger operative report, that is myalgia. Myalgia will myalgia, muscle pain, unspecified myalgia we can see here. And let's read the operative report. Here's an trigger point injection in multiple muscles. Patient present with a chronic upper back pain, muscle spasm not relieved by medication. So procedure has been performed. The patient placed in comfortable position. Affected muscles are trapezius, deltoid, and rhomboid. So here three muscles will be there. Name is given: trapezius, deltoid, and rhomboid. Are identified and prepped with the antiseptic solution. Needle was inserted in the trigger point and mixture of local anesthetic steroid was given into three different muscles. And patient tolerated the procedure well and plan patient advised rest, physiotherapy follow up within the 1 week. So myalgia given. So CPT code is there. Unspecified sometimes if specified is there not there, then we have to give the other specified procedure. Injection, muzzle, muzzle injection. Trigger point is there. No? How many muscles are there? One or two or three? Three muscles are there. Not which two more? 20553. Okay. So this is an OP report. If there is an some ultrasound guidance is there, we should give the ultrasound code. We'll see 20553. We'll see in the book 20553. Do not if amazing guidance is there, we have to perform the. You can see here perform the 7 series course at 76,000 ultrasound guidance or maybe some fluoroscopic guidance if there, we have to use that. Okay. So this is a muzzle injection procedure. Okay, so thank you guys. That's it for the today. Okay, in the next session we'll continue to the tendon origin, plantar fasciotomy and tendon repair. Okay, so thank you guys.